Hello to everybody who is watching this video. My name is Alexey. I'm a doctor, Dr. Vorobiev, Drug Clinic, Belgrade. Today I would like to speak about drug addiction. I don't think that I'm going to leave a big secret that drug or narcotics have become a plague of modern society. Since the beginning of 2000, huge wave of drug abuse, including prescription drug abuse, is on the run all around the world and particularly in North America and Europe. The problem is so widespread, so popularized that even the stars of TV series such as Dr. House and Nurse Jackie are sitting on opiates. Drug addiction is getting common not only among losers, criminals or jaded stars of show business. Roxy, heroin, Vicodin appear to challenge ordinary, normal people. Successful businessmen, top managers, doctors, engineers increasingly become victims of drug abuse. In Russia, a fierce battle against drugs resulted in emergence of some kind of unbelievably monstrous drugs. Reduced supply of Afghan heroin resulted in changes in the Russian drug market. Kiev or high now is being extracted from anti-cough tablets, eye drops, antidepressants. Prepared from legal components, this sinister illegal mixture obtains properties of heroin, but it is more powerful and cheaper than heroin. Bills have to be paid. The new drug is called a crocodile. The name comes from aftermath of using the drug. Crocodile users suffer from thrombosis and gangrene of the extremities, which often lead to amputation. From 2006 to 2009, number of addicts in surgical wards in Russia has increased by 5 times. Recently, Western Europe was hit by spice, the smoking blend of exotic herbs having powerful euphoric and hallucinogenic effects. Teens tasted and evaluated the new product much faster than services responsible for drug traffic control. In less than 2 years of free sale, the level of intoxication psychosis, injuries, suicides caused by spice has grown up by 7 times. Austria, Macedonia, Slovenia are all suffering from the effects of substitution therapy. Used in harm reduction programs, such opioids as methadone, substitutol have become free narcotics for many addicts. Violating the rules of treatment, the patients elicit higher doses, use drugs prescribed for oral administration intravenously, often exchange them for heroin. Many addicts who are looking on methadone or substitutol therapy as a way to get narcotics free often find themselves cruelly deceived afterwards when they face with withdrawal from methadone, which instead of usual 5-7 days lasts almost a month and is much more harder than withdrawal from heroin. No better situation is in Serbia. Heroin addiction is getting younger. Grass, hashish, among adolescents is no longer considered as something dangerous or forbidden. At weekend at the club, under influence has become a common pastime. As a consequence, often in the newspapers you can see the obituaries of young people whose death as a rule is a result of drug abuse. All this brings to mind reports from the front lines about fighting the captured or liberated territories, the number of casualties. So, is there a perfect weapon that would have stopped this war? The large pharmaceutical companies increasingly make statements that vaccine against drugs will be created soon. It has recently become known that only the United States National Institute of Drug Abuse by itself simultaneously is elaborating 13 medications supposed to win addiction to methamphetamine and cocaine. British pharmaceutical company Xenon is going to release anti-cocaine vaccine in 2012. Vaccine is supposed to bind molecules of cocaine with blood proteins and an account of enlarged molecular size prevents fixed cocaine going from bloodstream to brain receptors. Launched in 2006 in Russia, experiments with xenon gas as a promising tool of anesthesia and neuroprotection for patients with brain injuries and anemia brain damage led to the startling results. Addicts who after several months of conventional anti-drug treatment still persisted maniacal desire for methamphetamine already after 5-7 sessions by xenon therapy were nicely surprised to state that their head was clear from all follies. In 2009, xenon was approved for use to relieve drug craving and addiction treatment protocols. As well as many forms of cancer, drug addiction has become a curable disease nowadays. Argued that the treatment doesn't work, and only the patient's own strong will can solve the problem of addiction. This is a big mistake. Usually for the first 3-5 years of addiction, people are inclined to deny the existence of a problem. The next phase is postponing and searching for the shortest and cheapest treatment. And then the logical statement that nothing helps them is followed. Of course, motivation is very important. Nobody argues. However, it's meaningless to postpone treatment until the moment when motivation appears, when a person physically and emotionally will be completely worn out. Using someone's failing treatment to declare that addiction is incurable is a pure manipulation and shifting responsibility on parents. It's nature of a dependent. Recovered people try as soon as possible to forget the time of their lives connected to drugs. They are ashamed and sorry for many mistakes they made. People just don't want to recall the time. For man of sense, it's stupid to walk around and boast to everybody that he was cured. On the contrary, the drug addict with peculiar tendency to shift responsible behavior for empty rhetoric will be arguing that treatment doesn't help, because 2 or 3 of 10 because the negative feedback on different drug forums and on the street always prevails. Professionals of our clinic were on business trips all around the world: United States of America, Great Britain, Germany, Switzerland, China, Czech Republic, Mexico, other countries where they have been trained or shared their experience at the best clinics. The latest pharmacotherapy, apparatus for endorphin stimulation, neuroelectrical therapy, information therapy directed to erase memory of drugs, range of hypnotic techniques, means to normalize metabolism and restore immunity, pharmacological anti-drug blockade, mental blockade, counseling program directed to forge a new identity with mentality of a winner, not a whimpering loser. All these implements are in the arsenal of our clinic. An opportunity to send a patient to any hospital all around the world. An opportunity to be treated by any method known in modern medicine. Rehabilitation in different countries. A cooperation with leading national health centers and institutes for drug addiction treatment. All this give us a chance to defeat a disease, even if it comes to the hardest case. We have over 18 years of experience. Our clinic operates in Russia, Serbia, and Mexico. We have consulting point in Arab Emirates. The total number of beds in our clinics is 100. Over 300 medical professionals have saved and returned thousands of patients to a normal, happy life and carry on doing this every day. People save lives, their drug-free lives are the testimony of our words.
Then I heard about clinic of Dr. Vorobiev from my friend, and I came here and I have received comfortable painless detox in 3 days. I had no pain, I sleep well, my appetite was good and I feel so good. No depression, no aggression. I am very glad from this situation. Yesterday test showed that I'm clear and today I'm going home.
I had big problems with methadone. I used for 50 pills per day, and I heard about this clinic. Methadone is a big problem, the bigger one than heroin. And I'm very satisfied because now my body is clean and I'm sure in myself and I want to go home and everything is nice and happy.
We affirm addiction is cured.